Hello, everyone, and welcome to this brief webinar on 4 simple steps for low back pain relief. My name is Dr. Nate Merhaut, and I have been helping people with low back pain for years. I currently work for Elite Sports and Spine in our St. Peters, Missouri office. I have a master's in sports science and rehabilitation and a doctorate in chiropractic, both from Logan University. I'm also a certified chiropractic sports physician through the American Chiropractic Board of Sports Physicians. Lastly, I'm one of the co-creators of the BackFix program, which was developed as an online program to help people like you to get long-lasting relief. Now, enough about me, and let's get into the reason you are here. As you can see, about 80% of people will experience low back pain at some point in their life. Unfortunately, I'm guessing you are part of that stat since you are attending this webinar. You might have tried many different treatment methods ranging from drugs and injections to massage therapy or physical therapy. There's even a chance surgery was recommended to you. The average cost of low back surgery is $20,000. Think about what you could do with that money if you didn't have to go through with low back surgery. Let's take a look at 4 simple steps I have for you to start your journey to a back pain-free life. If you follow these steps, I guarantee you'll have a much better outcome than what you have dealt with so far. Step number 1 is determine the type of low back pain you have. If this first step is not done, you'll be going down the wrong path from the start. Let's take a look. Here we have a list of 2 types of low back pain, acute and chronic. Under each category, you see a few subcategories. Let's start with acute. Acute low back pain refers to low back pain that has suddenly appeared. This is usually from a fall, accident, or specific injury. On the other hand, we have chronic low back pain. Chronic low back pain is something that you have been dealing with for a long time, either consistently or on and off throughout the years. Acute low back pain is more commonly high on the pain scale and requires immediate care. Chronic low back pain can be nagging and hinder you from doing the things you love and used to be able to do. Even though both are different, they can both cause a lot of discomfort and problems in your everyday life. Once you determine if you have acute or chronic low back pain, you need to determine if pain is radiating or non-radiating. To figure this out, you simply ask yourself, does my pain or symptoms travel anywhere? Does your pain or symptoms go down your leg or up into your back? Does it travel around to the front of your hip, or does it remain in the same spot? If the pain or symptoms travel, you have radiating low back pain. If the pain or symptoms stay in the same spot, you have non-radiating low back pain. From there, we also need to know if there is any numbness or weakness associated with your low back pain. This is a simple yes or no question once we get to this point. Next, we move on to step 2, which is determining the source of pain. Everything we learned from step 1 helps us determine our answers in step 2. Here we have listed some common sources of low back pain. There's disc, stenosis, muscle, joint, nerve, and bone. The types and sources of low back pain are linked together. If we look at acute, we have disc herniation. Now, disc can also be a chronic condition if we look over on the other side where we have degenerative disc disease. If the pain source is muscle, it can be an acute sprain or strain, or something more chronic where you have trigger points and chronically tight muscles. Bone pain can come from a fracture. And if we look at both sides, we have compression as well as a spondylolytic spondylolisthesis. So a compression fracture on the acute side can be from a traumatic fall or injury. Same thing with the spondylolytic spondylolisthesis. That simply means that there was a fracture in the pars interarticularis, which is a part of the spine, and it separates and slips forward. Now, if we look at the chronic side, the osteoporosis and osteopenia can cause a compression fracture and can also cause a spondylolytic spondylolisthesis. You can also have joint inflammation. On the acute side, it'd be an immediate injury to the joint, immediate blow to that specific joint that would cause it to be inflamed. Or on the chronic side, you would have degenerative joint disease or joint arthritis. Then we look into the nerve. Nerve irritation can happen in the acute stage, immediate irritation to the nerve, or you can have nerve damage and irritation in the chronic stage, so something that takes place over time that gradually will irritate the nerve. And last, we have stenosis. Stenosis simply meaning closing of an area, whether that's the spinal canal or the foramina where the nerve roots come out. Once we have determined the type and source of low back pain, we need to determine what makes it better and what makes it worse. This is a key part in determining the proper treatment for your low back pain. First, let's look into what makes your low back pain better. The majority of low back pain can be put into two categories: flexion tolerant and extension tolerant, meaning your low back pain gets better with flexion, like bending forward, or extension, like bending back. You may or may not know which category you fall into, but there are easy ways to determine which category you fit under. For example, if you have low back pain and it feels better when you sit down, you most likely fall into the flexion tolerant category. If you have low back pain and it feels better when you're standing, you most likely fall into the extension tolerant category. Sometimes it isn't as easy as sitting and standing to determine which one feels better, so there are other ways to determine which one it is. One proven method of checking for extension tolerant low back pain is called the McKenzie method. This method involves a series of repetitive movements in order to see if it decreases low back pain or symptoms. The first step in the McKenzie method is to lay prone or flat on your belly. Remain in this position for a few minutes to determine if it helps your low back pain. The second step would be to prop yourself up on your forearms and hold this position for a few minutes to see if it helps decrease your low back symptoms. Next, you can do a series of prone press-ups, kind of like a push-up, but keeping your hips on the ground, to see if your low back symptoms decrease. If any of these steps decrease your pain or symptoms, you're considered extension tolerant. Determining if your back pain is flexion tolerant is done in a similar way, but using a flexion movement instead of extension movements. The McKenzie method can also be used for flexion tolerant patients. To start out, you can lay on your back and hold this position for about 30 seconds to a minute. See if your back pain improves. Then you can lay on your back with your knees bent up, see if your back pain improves. Then have the patient pull their knees to their chest and hold this position for 30 seconds to a minute to see if the symptoms and pain changes. Next, I will have the patient do a reverse crunch for a total of 20 repetitions. I follow this by having the patient do a curl up to see if their pain and symptoms decrease. The reverse crunch and curl up are not pictured on this slide, so you'd have to look those up separately. If any of these symptoms decrease the pain or symptoms, you can consider yourself to have flexion tolerant low back pain. Now, not everyone will fall into a flexion tolerant and extension tolerant category. There are other movements and actions that can decrease pain and symptoms to help determine the best course of treatment. Sometimes leaning to one side or bending to one side helps decrease the pain. Sometimes twisting or applying pressure to the area relieves the pain. Sometimes ice or heat or topical ointment can help. These are all clues as to what course of treatment should be taken. Now that we've gone through what can make your low back pain better, it is simple to also determine what makes your low back pain worse. The same methods can be used to determine provocative things for your low back pain. Also, you want to look into your daily routine to see if there's something you're doing every day that can be causing your low back pain. Some of these things include sleeping position, your job, how you sit in your car, or even a hobby. Do you have pain while doing anything throughout the day? Take note and see if there is a possible cause or provoking factor in your daily routine. We have gotten through the type and the source of your low back pain. We also went through things that make your low back pain better and worse. Now it is time to look at step 4 and determine the best course of action for treatment. I'm going to break up treatment into two main categories: surgery and conservative care. Most people try to avoid surgery unless it's absolutely necessary. I typically will not recommend surgery to a patient unless there is no other option for the patient. There's a time and place for surgery, but if we can avoid it, there's a chance you have a better long-term outcome. First, let's look at some of the most common types of low back surgery. We have vertebroplasty or kyphoplasty, which is typically done when there is a compression fracture of the vertebral body. The compression fracture can be acute from a serious fall or chronic from osteoporosis compression fractures. Next, we have spinal laminectomy or a spinal decompression. This is used to open up the spinal canal and give the spinal cord and spinal nerves more space. This is commonly done for patients diagnosed with stenosis. A discectomy or microdiscectomy is done to remove all or part of the vertebral disc. This is used to remove a disc herniation or a ruptured disc. A foraminotomy is when they go in and enlarge the spinal foramina where the spinal nerves travel through so that the nerves have more space and room to function. A spinal fusion is when two or more spinal vertebrae are fused together to prevent those joints from moving. This is often done after a severe accident or in a severe low back pain patient. An artificial disc replacement is done to replace a damaged disc completely with an artificial disc. Radiofrequency ablation is when the doctor surgically burns the nerve roots to relieve pain. Each of these surgeries is done for a different reason and all have different outcomes. Some surgeries are very successful and help the patient, and other surgeries may leave the patient in pain due to a misdiagnosis or complicating factors. It is important to research all options to determine if surgery is the right form of treatment for you. Now that we've gone over most common types of low back surgeries, let's take a look at the most common types of conservative care. Physical therapy and chiropractic care are two of the most common you will hear about. Both of these treatment methods can help resolve low back pain. When going to a physical therapist or chiropractor, they often incorporate treatments like massage, acupuncture, electrical modalities, laser therapy, and even yoga or Pilates. Oftentimes, these treatments are used together and get great results. Other forms of conservative care include spinal cord stimulators, pain pumps, medications like opioids, and shots or injections. Some of these treatments are designed to correct the problem, and others are designed for temporary relief. It is important to know the difference when implementing a certain type of treatment. If you have had unsuccessful outcomes with any of these treatment methods, there's a chance your low back pain was misdiagnosed and the proper treatment was not applied. That is why it is so important to go through the 4 steps to have a successful outcome. Most patients I've seen over the years have been to multiple providers and tried many treatment methods to help their low back pain. I often find these patients were misdiagnosed and provided the wrong type of treatment for their low back pain. A misdiagnosis can lead to the wrong treatment and mean hundreds or even thousands of dollars wasted on unsuccessful treatment. For that reason, I look forward to helping many people figure out the type of pain and the source of pain in order to guide them in the right direction to a successful treatment plan. If you feel like any of this information was helpful, or you feel like you have been misdiagnosed and provided the wrong type of treatment, I am happy to help. Please don't hesitate to schedule a virtual or in-person appointment with me so I can help you start down the right path in a back pain-free life.